This podcast is brought to you by Knowledge at Wharton. For more information, please visit knowledge.wharton.upenn.edu.
Several million people each year have LASIK surgery to help improve their eyesight, and it works very well. But there have been studies over the last decade that have brought up stories of side effects in a small portion of patients. In fact, in 2009, the percentage with negative effects was put at less than 1%. But a follow-up to that report suggests that the numbers may be higher, maybe even upwards of 5%. To discuss this study, we welcome into the studio Rob Field, who's a professor of law and professor of health management and policy at Drexel University. Rob, great to see you again. Thanks for joining us.
Sure, happy to be here.
Thank you. And also joining us, Mark Pyfer, who is a surgeon here linked through the University of Pennsylvania. Mark, great to have you here on the studio. Teaching faculty at Wills Eye here in Philadelphia. Mark, great to have you on the show.
Great to join you.
Thank you very much. Mark, I'll start with you. And this reporting is interesting, as I was mentioning with Rob here in the studio, that the numbers of people that they looked at in this reporting seemingly is fairly small, and they're looking at realistically a short period of time after people had the procedure, correct?
Yes, exactly. Those are the limits of the study because they're really only looking at the first 3 months, which is when most patients will have some transient symptoms, and we know this.
So how much stock do you put into this reporting? Obviously, there's an element to be considered here, but with it there being some sort of limits to the study, how much stock do you put into it?
Well, I think that the study was very well done. It was sponsored by the National Eye Institute. The name of the study is PROWL, Patient-Reported Outcomes with LASIK, and was done in 2 parts. The first part was in the military at the Navy, which has been a leader in refractive surgery, not just for military personnel, but in publishing their results in healthy patients that are very compliant for this country and for the world, basically. So, and this has led to the military allowing LASIK to be done for their patients, and even requiring, in some cases, for pilots who need perfect vision.
Right.
So it was a well-done study with good follow-up, but like you said, small numbers and short period of time.
Rob, what was your?
They only looked at 3 months out.
Rob, what was your reaction to the study?
I thought it was kind of an alarm, but not a warning. It's an alarm bell saying, let's look a little bit deeper. We obviously need to go beyond 3 months.
Right.
There may be something here, but it's certainly not a warning. Watch out, if you're going to get LASIK, you're in for trouble. The FDA's job is to make sure that procedures like this are safe.
Right.
So it's a nudge to the FDA to do a little bit more research and see if anything lies behind it.
We're joined by Rob Field from Drexel University and also Mark Pyfer from Wills Eye Hospital here in Philadelphia. Your comments are welcome at 844-WHARTON, 844-942-7866 is the number to give us a call. One of the interesting things, Rob, is the fact that if anybody is going for any type of procedure, they tell you to be careful and thoughtful in the process. I don't think any of the people that probably were talked to in this survey were not thoughtful in the process. It's just, the results of what happened because of potentially having the procedure, correct?
Yeah, healthcare is like anything else. Let the buyer beware. And even more so because your life and your health and maybe your vision are at stake, and it's much harder to evaluate what the risks are. But nothing is risk-free, especially when they're opening your eye up and flipping the cornea. And you have to be aware that most people will be fine, but there's going to be some percentage that are not. It's true for every procedure, for every drug, for almost anything you can do in healthcare, and you have to be prepared to be one of them.
How do the doctors handle that, Mark? Because when you're doing a procedure like this, and in terms of disclosure, I had LASIK more than a decade ago, and I have not had any problems, since I had that. And I would think, Mark, that I'm very much in the majority where this is the case.
Yes, you are, absolutely. In fact, that's what we hear from our patients. I mean, I wouldn't do this procedure if my patients were unhappy. I do many, we treat pathology. I do many different types of surgery, but LASIK is one of my favorite procedures because the patients do so well and are so happy. I think what you mentioned about just surgery in general. It's any responsible surgeon will inform their patients of potential side effects, both temporary or, in rare cases, permanent.
Right.
And part of the preoperative testing we do, it's another reason to go to a center like Wills Eye, where we're not doing this in a mall or in an office somewhere on the street. We're doing careful preoperative testing and qualifying patients and avoiding those, hopefully avoiding problems by weeding patients out who may not be good candidates for the procedure, or at least counseling them appropriately. You're at higher risk for dry eye, and we're going to manage that preoperatively and postoperatively. In fact, that was the most common reported symptom. They mentioned about 30% of patients had dry eye, and we know this, and we use both pharmacological measures pre and post-op, as well as some physical measures like something called punctal plugs that prevent the tears from draining too quickly and can treat both temporary and longer-term dry eye. So,
well, I was going to ask you what are some of the potential ways to be able to manage some of these issues, like with the issue one that they talk about is having that kind of halo effect that people see. How do you potentially correct that going back after having the procedure?
Well, there are multiple reasons for that, and the most common are temporary and transient and get better, including dry eye.
Right. Okay.
A dry corneal surface can cause distortions of vision with all types of symptoms. People will call that glare or halos or starbursts around lights at nighttime, because anything that interferes with your focus is much more pronounced at night when the pupil's larger and the corneal surface has to be perfect. So many of those symptoms go together for one primary underlying reason. And the second most common is some underlying residual refractive error. If it's not completely treated, a little residual astigmatism, a little residual nearsightedness, and patients are now comparing their best vision preoperatively in glasses or contacts with their uncorrected vision postoperatively. So most people are doing this to be independent of glasses. But there are a small percentage, maybe 5 to 10%, who have a little residual refractive error who may benefit from a small correction, say at nighttime, or even a fine-tuning, an enhancement of the procedure. We know that that's about 3% overall, where once a patient is healed 3, 6 months or longer and stable, if there's any residual uncorrected error that wasn't corrected by the first surgery, they can come back and have a touch-up procedure or an enhancement. So this study was too short to really look at that, and that 5% of patients that had some residual visual symptoms, some of those could have been due to uncorrected refractive error, where it healed. Everybody heals a little differently, so you're not dealing with a piece of wood or a piece of metal. This is a human cornea that changes shape based on humidity and atmospheric pressure and other factors and dryness. So there can be fluctuations during the day, and a small percentage will need enhancement. So I think it's valuable information for us to use in counseling patients, but I didn't find that the study itself taught me anything I didn't already know by talking to my patients.
Well, I want to ask you: do you think that this is a study, now that it obviously is become a piece that the media is covering very very closely? Do you think that this is a study that deserves a follow up with those specific people that were involved in this study? In the next couple of years.
Well, certainly longer term, if there's a plan. I think they closed the study. The military study was ended, and there was no plan to do further follow-up. But I think it certainly would be useful to have longer-term information or some controlled, and the FDA may require that even, to have a kind of a controlled standard questionnaire.
Right.
And I wouldn't mind doing that. I think any responsible surgeon would be willing to do that, both preoperatively and postoperatively at 3 months, and then maybe a year or 2 years down the road, to really get some good information and put that to rest. I think that this was motivated by a small percentage of very vocal patients who weren't, who were unhappy for one reason or the other, and had, really, put their opinions online and gotten to the FDA to convince the FDA to say, okay, let's really look at this in an unbiased way. And I think it really does confirm that, like what you're saying, that you were very happy with the procedure, and the majority of my patients. That the incidence of significant side effect is still less than 5%, which is very successful, really, for any type of surgery. But it's not something to go into lightly. And I mean, most consumers would know that and understand it, and most surgeons will present their patients with their options. And for a patient who says, I like glasses and I have no problem, then continue to wear glasses.
I think that touches on a broader policy issue here and sort of business issue for the surgery, is that for most people, and please correct me if I'm wrong, it's elective. It's your choice, which means that for most people, it's not covered by insurance.
Right.
It's out of your pocket.
Yep.
So this is one of those rare instances in healthcare where there truly is a free market, where you don't have an insurance company overseeing what happens, either telling you can't have it because they don't think it's necessary, or overseeing the provider and seeing if they follow quality guidelines and utilization guidelines and so forth. So there's more of a possibility for it to be the Wild West when you don't have that extra element of Medicare or Medicaid or a private insurance company, which I think heightens the need for the regulators to be vigilant, which is not to say that they've uncovered a serious problem, but it is to say that a totally unregulated healthcare market is not the same thing as an unregulated market for TV sets or for breakfast cereal. It's another level of scrutiny that's needed.
I guess, Mark, the other piece to it is for the consumer that is thinking about having LASIK. Just like, as we said before, with any procedure, you want to be very aware and have, I guess, a conversation, maybe even a couple conversations with the doctor that would be potentially performing this surgery to talk about all of these different elements. And in fact, for some consumers, it may be a good idea for them to have this conversation with a couple of different doctors about this so that they feel comfortable with the person that's actually doing the procedure.
Absolutely. In fact, a significant percentage of my patients have also gotten opinions elsewhere, and I think that's prudent in any procedure that's as critical as LASIK eye surgery, and especially if you're paying out of pocket. Any cosmetic or elective procedure you want to understand completely and making sure it's something worthwhile. Patients are coming to us for quality of life improvement, and that's the difference. If they're having symptoms with contact lenses, or they're unhappy wearing glasses for both sports or cosmetic reasons, then they're asking us, can you improve my quality of life? Can you do a procedure that's going to allow me to function without correction and see at least as well as I did with glasses or contact lenses? We almost never promise better vision or something that's an improvement, although very often we see that.
Right.
But mainly it's to allow better functioning without a prosthetic, similar to knee replacement versus using crutches or a wheelchair. It's a quality of life improvement. Is it essential surgery for survival? No, but it certainly makes a big difference in a patient's quality of life.
Rob?
Yeah. So the other issue here is it's the patient's own money. And
Sure, yeah.
And there would be that added element of regret if there were a problem. Now I'm seeing halos and I'm out whatever it is, $2,000 or whatever it costs. So the theory of the market in healthcare is it's the money that's the check, that you won't want to spend your money on something that doesn't work or that's dangerous. But we have this other level that it's one thing to be out a couple of $1,000s. It's another thing to be out that much money and have trouble driving, say. Right. So that does add another level where the FDA does have a responsibility to be a little bit more involved.
How much does the FDA get involved right now, Mark, in terms of kind of overseeing this? And obviously this study, as you said, may get them even to a degree more involved in looking into this.
Well, they certainly have to approve any procedure, any device that we use, the laser that's used. We actually, in the most common procedure nowadays, and there have been significant improvements even in the last 15 or 16 years since I've been doing this procedure, significant improvements in lasers. There's no blade used. Most of us use a laser to create the flap. If we do create a flap, a significant percentage of procedures are without a flap, just done on the surface. The excimer laser is the one that does the corneal reshaping, and the femtosecond laser is used to make the flap. Both of these devices have to be approved by the FDA. The manufacturer has to submit studies for safety and efficacy, and there's post-marketing surveillance like there is with any surgical device or drug, that if problems occur later on, those are reported, and manufacturers can be forced to fix that, or to the device could have to stop being used until that problem is fixed. So there is scrutiny of the devices that we use
So if I can ask a question, I'm just curious of Mark, how often do you have patients who either change their mind and decide they don't want to take whatever risks might be involved, or that you decide are not appropriate?
Probably of patients who are interested, I would say on average 10 to 15%, I would say that they have some contraindication to the procedure. Either, most commonly, it's an abnormal corneal shape. Sometimes it's an other problem that's not going to be fixed by LASIK, a misconception, patients with some other vision-limiting problem that's not a refractive error, nearsightedness, farsightedness, or astigmatism, or what we call refractive errors. Some patients have a cataract, and they think they need LASIK, but they really need cataract surgery. And fortunately, we have good technology in that area as well to improve vision and decrease dependence on glasses. So I'd say on average it's about 15%. Some patients come in and they're just curious. They want to know, am I a candidate, but they're not ready to have the surgery, both for financial reasons or for fear of risk. And I think that's appropriate. I've had many patients take years to make the decision. They're not ready yet. They come back a few years later, and it could be 5, sometimes 10 years later that someone will say, okay, I'm ready. I've seen enough of my friends go through this, and I'm sick and tired of putting contact lenses in every day or being dependent on glasses. So, it's not a decision most people should enter into lightly, and I totally support that as a surgeon. I don't want to treat anybody who's going to regret having it done. I mean, it's an elective procedure like anything else. So,
but we
want
won't
to make positive improve. We want to improve people's lives.
But in your opinion, we won't see a day where this is something other than an elective procedure, correct?
I don't think so. I mean, there are some, and this has decreased over the years, but there were some employers who would cover this for their patients as part of a healthcare package that patients that have premium coverage. If they cover glasses or contact lenses, if you look at the lifetime cost of those, that's approximately the same as LASIK, which for most people is somewhere in the neighborhood of $4,000 to $5,000 for both eyes. So some companies elect to cover it, but for the most part, it's still elective or cosmetic, just like plastic surgery and other elective procedures.
So I think what makes the shopping so difficult is I would certainly have confidence going to Will's Eye or any of the other major centers. I don't know how much variation there is in this. Would everyone be as candid with their patients as to whether they really needed it or whether it was really appropriate? I think that's where the issue is.
Right.
The great unknown of physicians, of clinics that aren't going to be as candid and honest. And I think
that's a very important point, because when it's a commercial procedure that people advertise, and for places that depend on LASIK or refractive surgery for their livelihood. And that's an important point. If you have a center who that's all they do, well, then they're going to market more heavily because that's their business. I do I take care of other types of eye problems. I'm not dependent on refractive surgery to pay my bills, but it is a procedure I offer because it is rewarding, and we have good technology to help patients.
But it's also something you don't want to make this basically into like an assembly line, that type of operation.
Right. And, also be careful with discounters. Many of the places, and I don't want to single any particular provider out, but if you're doing the procedure at a discount, many times they're cutting some corners somewhere to save that money. The lasers are very expensive, and they have per-use fees associated with them, but you can use an older device that is less expensive, or use a blade instead of a laser to make the flap, which worked very well, but we have better, more predictable technology now. So it's important to know what the latest procedure is and what's being offered, and then if you are going to a discount provider, find out how are they saving that money. What corners are they cutting to decrease the cost?
Well, corners of your cornea.
Well, right, and I'm like I said, I got this done more than a decade ago, Mark. So I was one of those people that did actually have the cornea flap.
Sure.
And for all honesty, and I'm sure anybody that's gone through the procedure, they know that obviously you're sedated, but still it is a little bit of an unusual feeling when the doctor actually pulls back the flap of your cornea, and you can see it. I mean, you can't really feel it, but you can see it. And it's one of the more unique things I've ever had to go through in my life.
Right. I mean, most patients do remember it, and even though it only takes 10 minutes, it's an unforgettable procedure. And fortunately, the results overall are very good, as you had mentioned. And, I think that the long-term studies are important just to understand, because the unhappy, happy patients basically go away happy and don't talk about it. The very rare unhappy patient can be very vocal, and they're the ones that are getting attention from the FDA, and I think that's part of the reason the study was motivated, just to find out how common is this? Is there anything that we really should be aware of and we should be looking at, and maybe screening more appropriately, or strongly recommending that surgeons, screen out, do more extensive, say, dry eye testing, and so forth.
And I think the follow-up study should also look at what kinds of doctors were doing the surgery and whether those correlate with reported problems.
Mark, I know which device was used.
Mm-hmm. Exactly. Yeah, Mark, I know you have to run. Thank you very much for giving us your time today.
Oh, you're very welcome. It's my pleasure.
Thank you. Mark Pyfer, who's a member of the teaching faculty at Wills Eye Hospital here in Philadelphia. We continue on with Rob Field from Drexel University. Because of the fact that it is one study, and as we said, the numbers of people are so small, even because of that, as Mark just kind of mentioned, it will be something that kind of will catch the radar of the FDA, and it will be something that they will be aware of. How much they kind of get into it, we still probably don't know, but it does warrant the FDA at least being aware of it and at least thinking about it.
It certainly should. And it's as Mark was saying, there's the equipment and the devices. There's also the procedure itself. But I think the broader implication here is more important, that there are other procedures out there, particularly those that are self-pay, where the insurance company is not playing an oversight role, where people have to understand that a discount really can be penny wise and pound foolish, that if you end up not being able to drive at night, that $1,000 you saved is going to seem pretty trivial. And it goes to the larger debates about is healthcare viable in a market? And what kinds of protections do we need?
Right.
And you don't want the 2-for-1 specials when your eyesight's involved.
Well, I guess to a degree, I am surprised that it isn't more of an element that is covered by insurance across the board, because of what Mark said, of the fact that, look, if you're using contact lenses, the cost of that over a lifetime is about the same as the cost. And what surprised me was, as I said, I had mine done more than a decade ago, and the cost that I had back then is about the same as what it is now. There wasn't a marginal increase, which I was absolutely stunned by. I figured, the cost of time, cost of equipment and lasers, obviously the cost would go up. It was about the same.
Yeah, amazing example of efficiency over time. From the insurance company's business point of view, though, a couple of issues. One is vision is usually separate. So the general health insurer is not the one paying for eyeglasses or contact lenses. And secondly, a fact of our private health insurance system is that people switch. And a typical customer stays on a policy for about 2 years. And sometimes it's not your decision. Sometimes it's your employer's decision. So the money that they spend today may be a savings for another insurance company down the road. So that the preventive aspect doesn't always translate into dollars and cents.
It's funny doing this segment and talking with you guys about it. It felt like my eyes were getting dry just doing this today. Obviously, but as I said, it's been more than a decade for me, and I haven't had any issues whatsoever with it. And that's the majority. That's the 95% or 96%, whatever that number is.
Yeah, well, that's why the follow-up study needs to be a lot more rigorous, because there's the power of suggestion. Do you have a dry eye? Now that I think of it, maybe I do. Do you say hellos? Oh, yeah, maybe I do. So you have to be very careful when it's self-reporting.
Great to have you here. Thanks, Rob.
Thank you. Happy to be here.
You got it. Rob Field, Professor of Law and Professor of Health Management and Policy at Drexel University.
For more business news and analysis from Knowledge at Wharton, please visit knowledge.wharton.upenn.edu.